Hello and welcome to another Pipecast. Today we're going to look at medications, and the drug we're going to look at is Valacyclovir. So let's start off and get straight into it. So Valacyclovir, which I'll most likely commonly call just Acyclovir, is used for your herpes viruses. Okay, so commonly used in cream form for your herpes labialis, or it's commonly known as oral cold sores. It's also used for genital herpes, and it can be used for herpes zoster, which is your shingles or chickenpox. So having a look at herpes simplex, there's a little bit of misconception associated with the herpes simplex virus, and it is a very, very common virus for people to have. Okay, certain studies have said as high as 60% of people can carry herpes simplex virus 1. Now, HSV1 is commonly associated with oral herpes, but it can cause genital herpes. Okay, now this outbreak, like herpes simplex 2, is less frequent over time. So as you have it for longer and longer, you tend to have less outbreaks. Now this particular one is spread via saliva. So any kissing, oral sex, drinking same water bottles, anything like that. So very common in children for the drinking of water bottles. And more importantly, sharing each other's water bottles, I'd like to add. Now, that is the most common one that you'll hear and you'll find most people have. Okay, it's usually passed on very early at a young age, and then you'll carry it throughout your life. Now, HSV2 is often associated with genital herpes, so most commonly causes genital herpes, but can appear around the mouth. So the oral herpes can transfer to genitals, and the genitals can transfer to orals. It's just statistically more probable to have HSV1 on the mouth and HSV2 on the genitals. Now, these ones are transferred through skin-to-skin contact. Okay, so skin getting really close, lubrication, micro tears, things like that does help, and it's less prevalent, but still 1 in 6 people tend to have it by childhood. Now, the way it works is the HSV finds a way to get into the body, some form of transfer, and from there it automatically starts replicating at the site. Now, it's particularly important to note and remember how viruses replicate themselves. Okay, so simple terms, they inject their own DNA into our cells and then go through or encourage the process of protein synthesis and DNA synthesis in order to produce more viruses that can then spread to further cells. Now, because they're in the cells, our natural killer cells and our helper T cells, they play a huge role in limiting it or killing it right at the start. Okay. Now, if there's enough of them and it gets through, then that virus travels down the actual axon until it gets to the ganglion. Okay, so the ganglion, either in the sacral nerve usually for genital herpes, or trigeminal ganglion for oral herpes, is where it sits. And from there it will sit until it can sort of break out and come back in latent infection or reoccurring infections. Now, that often occurs at the site of immunosuppression, stress, overheating, salt intake, exposure to sunlight, and in some cases of trauma as well, where you lose a significant amount of blood, you can get a HSV eruption. Now, from there, once you get in the infectious state, you'll get vesicles or lesions occurring on the area, and that contains the fluid, and it's the fluid that is mostly has that massive viral load that can be transferred on to the other person, either through saliva or through the actual weepiness of the serous solution from the lesions around the genitals. Okay, so looking at the drug itself, Acyclovir. Now, the good thing is we can call it Acyclovir because it's rapidly absorbed and it has a basically 50% bioavailability as Acyclovir. Okay, so once it's distributed around the body, it's only distributed as Acyclovir. Okay, and it travels pretty much throughout the body. Okay, so we're talking can get to the brain, can go to the kidneys, all through your muscles, urethras, lungs, vaginal cavities, and even your CSF as well. Okay, now it is slightly protein bound, about 13 to 18% protein bound. Okay, so not too great, but still can be significant. And it's metabolized pretty much completely by the liver in first pass metabolism. So first pass metabolism, it rapidly becomes acyclovir, and then from there it is further broken down into inactive metabolites, where it is pretty much solely excreted by the urine. Now the half-life of Acyclovir is about 2.5 to 3 hours, okay? But the half-life of Valacyclovir, so before it's converted to Acyclovir, is only around 30 minutes, or in a lot of cases it's less than 30 minutes in healthy adults. Now because it is metabolized so rapidly in first pass metabolism, slightly protein bound and primarily excreted by the urine, there are significant considerations with creatine clearance and anyone that has acute renal failure, and particularly using it with the elderly. Now if pharmacokinetics is something you haven't looked at in a while, and things that I'm talking about, absorption, distribution, metabolism, is not quite making sense, then understanding pharmacology will break down all the different aspects of pharmacokinetics, so then you can get a better understanding. Okay, moving on to pharmacodynamics, so what the drug actually does. So as I've already talked about, it's rapidly converted to Acyclovir. Okay, once it's converted with Acyclovir, it goes through a process of competing with deoxygenasin triphosphate for only viral DNA, okay, or in particular viral DNA polymerase, to inhibit the DNA synthesis and in turn the viral replication. Now what that means is you need to have a little bit of understanding of protein synthesis. Now conveniently I will also link protein synthesis, so then you can get a better understanding of nucleotides, base pairs, creating polypeptides if you will, and also replicating DNA itself. But in simple terms, when we have a uninfected cell and it goes through the process of producing protein chains, a nucleoside binds with a phosphate, and then those particular nucleoside phosphate binds with other nucleosides to become base nucleotides. And from there, all the nucleotides are based together, and that sequence of nucleotides goes through DNA polymerase, which is then created into a new DNA strain. Okay, now this is done in the ribosomes, the same as any other protein synthesis, which is why that lesson could be useful for you. Now in an infected cell, the acyclovir mimics, okay, or is very closely chemically resembled to a nucleoside. So that binds with the phosphate, so when it goes through its creation, it creates a false nucleotide. And because it's a false nucleotide, it cannot actually go through DNA polymerase, and therefore it cannot replicate DNA. And if it can't replicate the DNA, they can't use that DNA in order to produce the protein strains to make the virus, stopping it in its tracks. Okay, so that's what Acyclovir does. Okay, now that we know what it does to the body and what the body does to it, let's start looking at a few things that we have to take into account when giving it to a patient. So good news is the only contraindication massively for Acyclovir is if they're hypersensitive to Acyclovir based. Now it is very important that treatment starts early, okay, because it's not a curative, it doesn't cure herpes simplex, okay, it just sort of puts it at bay or shortens the actual duration of the infection. You must give it as early as you can. So if you have early onset or your first onset, first diagnosis, never had it before, you need to give it within 72 hours of first symptoms, otherwise it's pretty useless. Now, after your first diagnosis, if someone constantly gets, or not constantly, or has had genital herpes or oral herpes in the past, then you need to give it within 24 hours of first reoccurring episode in order for it to be useful. It is pregnancy category B, okay, which means that it's had some testing, mostly on your animals, and it has shown risk to fetal growth. Okay, now the main thing is the drug is excreted in the breast milk, so realistically it's used with caution. Looking at the adverse effects, as with most drugs, there are a lot of adverse effects that don't often come into play, but the ones that are shown greater than 10% include your headache, which has the highest prevalent, up to 35% of patients who take Acyclovir tablets, can end up with a headache. It's quite common, about 15-16%, to have elevated ASTs or ALTs, remembering their liver enzymes. Some patients can get neutropenic, meaning their white blood cell count can lower a little bit. Abdominal pain happens to about 10% of patients, 10% of people, a little bit greater than 10% of the time. Okay, so not 1 in 10 people that take it. And you can also get nasopharyngitis. Now, the adverse effects that are less prevalent than that can include arthralgia, dizziness, vomiting, rhinorrhea, dysmenorrhea can occur as well. And then the really rare ones of note can be aggression, alopecia, confusion. You can even get hypertension and tachycardia, but those are very rare and usually associated with the elderly or those that have renal complications as well. As far as drug interactions go, there's luckily not a lot. Okay, so there's no drug that makes it an absolute contraindication. Okay, but there are a few that you need to be aware of because they have serious complications or serious interactions, and it's best to use an alternative. Now, bacitracin cream is one of those drugs that do not play well with Acyclovir. Now, this is not to be mistaken with our Bactroban that we use. Okay, Bactroban is a completely different drug to bacitracin. Okay, so there is no interactions with Bactroban, but if they are on bacitracin cream, it is best definitely not to use Acyclovir. If they're taking an antibiotic within the ertapenem categories, so they're the ones that act on the cell wall. Okay, so they aid in blocking the synthesis of the cell walls in order to cause them to break down. Okay, so imidapenem is the main one to look out for, but pretty much anything within the ertapenem class of bacteria, of antibiotics, it's best to choose a different drug or not give this one at all. If someone's on melanoma medication, okay, has serious complications as well. The other ones of particular note, clementine, which is your general H2 receptor antagonist. So it's used for reducing stomach acids. Now, if you ever have a patient that is taking any HIV medication, you can pretty much steer clear of Acyclovir completely. Okay, and the only other one that has minor interactions in something that you can see is your gout medication. Okay, so probendicide is a very common gout medication used, and it has a minor interaction with Acyclovir. So if anyone's on these medications, because Acyclovir is really not a curative agent, it can be best to avoid its use and then work with preventing its spread instead. Okay, the last thing to end on is just to talk about the clinical take-homes. Okay, so the cream is a very commonly used drug, okay, but even though you're using a cream, you still need to be aware of how it works. It has similar adverse effects, okay, obviously just less frequent. Okay, now it's very important, take-home messages is it must be used early, as soon as early symptoms show up. So if they've never had herpes before, then it has to be given within 72 hours. If it's a reoccurring and it's 24 hours later, there's a lot of arguments that state there's no benefit in actually giving it. It's going to last the same amount of time. Okay, it is not a curative treatment. Okay, so tell your patient that this will not cure it, and this is most likely going to be part of their life. Now, because herpes simplex virus is so common amongst the population, we don't need to go through contact tracing. Okay, it's not one of those STIs that needs contact tracing. Okay, but counselling in regards to preventing infection and spreading is important. Okay, you should encourage the partners to be checked, but there's no need to treat them. Okay, Acyclovir is not used as a prophylaxis for HSP. Okay, condoms or other barriers are very, very important, almost a necessity, you could say, if they choose to engage in sexual activities whilst they have active lesions. So I hope you got something out of this particular one, and until next time, take care.